elective course Ethics and Medical Jurisprudence for 2nd BHMS professional course CBDC. Module 4, name of the module is Indian Medical Jurisprudence. This is lecture 4. This lecture 4 consists of medical legal case management. The speaker is Dr. myself, Dr. Ragini Raut, MD Homeopathy, HOD, Associate Professor, Department of Forensic Medicine and Toxicology, Bharati Vidyapith, Homeopathic Medical College, Pune. This module 4, medico legal case management, comprises of steps in handling medico legal cases, reporting and documentation protocols with regards to handling the medico legal cases, interaction with legal authorities, case studies and practical insights about the medico legal case management. In this, first we will discussing about the steps in handling medico legal cases. The initial responses: acknowledge the complaint, document details, assess and gather evidences, consult legal and medical experts and follow legal procedures. So, all the documentation details as per the protocol, then assess and gather the evidences as per the requirement of the case, and take the opinions of the legal consults and medical experts and follow the legal procedures. Provide emotional support, offer reassurance, listen empathetically, validate the feelings, provide information, maintain confidentiality and connect to counseling services if needed for providing the emotional support. Gather initial information, collect basic details about the incident, parties involved, medical history and witnesses, accounts to establish a case foundation. So, these are the certain things which come under the initial response, that is acknowledge the complaint, provide the emotional support and gather the initial informations. Regarding the documentation, collect and review medical records, obtain all the medical records, assesses for accuracy, identify discrepancies and evaluate the clinical details for the case evaluation. Document all the information and communications, record all the details and interactions meticulously, including date, time and content to ensure a clear and accurate case history. Maintain accurate detailed records, like ensure all the records are precise, comprehensive, up to date, documenting every aspect of case for legal and medical clarity. So, time, date, who brought, consent, all clear case history, accurate case history, to review all the medical records, all these things are very key aspects in handling the medico legal cases as per the documentations are related. Next is risk management. Identify the potential risks and liabilities, evaluate possible risks and liabilities by analyzing evidence, accessing medical practice and considering legal implications to mitigate potential issues. Assess the severity of the case. Evaluating the medical records and legal aspects, you have to assess the severity, intensity of the case, ensuring the appropriate legal and medical responses. Develop a risk management plan. Ensure all the records are precise, comprehensive, up to date, documenting every aspect of the case for legal and medical clarity. So, you have to assume the risk also while planning all these things and identify the potential risk also and liabilities also, that is called as a risk management. Investigations. Gather facts and evidence. Gathering facts and evidence involves collecting detailed medical records, witness statements and relevant documentation to support legal claims. Then next is interview witnesses and parties involved. Interviewing the witnesses and involved parties enables gathering further hand accounts the perspective to build a comprehensive case understanding and verify the facts. So, by doing investigations also you have to interview the witnesses and the parties for understanding and verification of the facts. Analyze medical records and documentation. Reviewing clinical histories, diagnosis, treatments and outcomes to assess the cases in medical aspects and credibility. So, you have to analyze the medical records and keep the documentations very properly and review the documents thoroughly. So, that is the part of the when you are handling the medical labels, this investigation part plays a major important role to gather and collect all the evidences in detail, then keeping the witnesses records, and all these things documentation, relevant documentation helps to give the support to the for the legal claims. These legal claims verify the facts, and this will help you the understanding the case in the comprehensive manner in the detail. So, reviewing all these clinical histories and diagnosis and treatments, which will can analyze the documentation and medical records properly. Expert opinion in handling the medico legal cases. Consults with the medical experts. While you are handling the medico legal cases and understanding the depth of the case, you have to consult the medical experts, seeking the professional opinion on medical issues to clarify, diagnose, treatment, validity, whether the treatment and diagnosis is valid and how this plays an important role, and the case impact also. So, that you have to really have to have an expert opinion in relation to this. Obtain expert opinion and reports. Obtaining expert opinions and reports involves soliciting detailed evaluations from specialists to provide informed insights and support in case arguments. So, by obtaining this opinion, you can involve the detailed evaluation of the specialists. Review and analyze the expert opinion. Reviewing and analyzing the expert opinions involves critically assessing their findings and conclusions to ensure they support the case and are scientifically valid. Legal consultations. Consult with legal counsel, seeking advice on legal strategies, case strength and implications to ensure effective case management and representations. So, consultation with the legal counsel is very important. Then understanding the legal implications and options involves analyzing potential legal consequences and available strategies to navigate the case effectively. So, that case is going in which side or in where it is landing. So, understanding these legal implications and options are beneficial. Develop a legal strategy, creating comprehensive plan to address the case goals, evidence, arguments and courtroom statics to achieve the best outcome. So, these legal consultations is required for the arguments, then the talkings or examinations and all the tactics to achieve the best outcome. Steps in handling the medico legal cases. Communication plays an important role. Keep the patients and families informed, providing clear timely updates on case progress, medical status and legal proceedings to ensure patients understand and can make informed decisions. So, that communication to keep the patient and families informed. The next step of the communication is communicate with the legal counsel and experts, sharing case details, discussing the strategies and interacting their insight to strengthen the case and ensures the effective representations. Next is maintain the transparent and open communication. Maintaining transparent and open communication involves sharing all relevant information honestly and clearly with all the parties to build trust and ensure the effective collaborations. So, transparent mechanism, your honesty, your open communication, which will help you clear concept about the parties, and you can seek the more ensure the effective collaboration. So, communication with the patients and families, communicate with the legal counsel. So, you have to be always in the touch and communication while maintaining the transparent and open communication. Negotiation and settlement. Explore the settlement options. Exploring the settlement options involves negotiating terms to resolve the case outside of the court, aiming for a mutually acceptable agreement to avoid the trial. So, negotiation and settlement is exploring the settlement outside the courtroom. Negotiate with opposing parties, discussing and compromising on terms to reach a mutually agreeable resolution and avoid prolonged litigation. Reach a mutually acceptable agreement. So, both the parties, when you are trying to communicating or trying to settle down the matter outside the court, both should be mutually acceptable agreement. Finding common ground between the parties to resolve the dispute satisfactorily where everyone is involved, and it should be the transparent mechanism. So, negotiation and settlement involves explore the settlement options, negotiate with the opposing parties and reach a mutually acceptable agreement. Litigation. Prepare for court proceedings, organizing evidence in the all the parts like oral, documentary, medical records, autopsy report, all these documents, developing the arguments and strategizing to effectively present in the case courtroom. So, prepare for the course proceedings. All these documentations, evidences, arguments, you have to plan and strategize all these things before you are presenting yourself in the courtroom. Present evidence and expert opinion, delivering organized, clear and persuasive information and expert insight to support the case in the court. So, present the evidence in the court of law. Defend against the allegations, presenting counter arguments, evidence and legal reasoning to refute claims and protect one's interest in the court. So, because of this preparation and court proceedings, if your evidences and clear cut indications and your explanations are better, so that counter arguments and evidences can be claimed and it can be protected in the court of law. Post case review, conduct a thorough review of the case, examining all the evidences, legal arguments and expert opinions to ensure comprehensive understanding and effective strategy. Identify areas for improvement involves assessing case strengths and weaknesses to enhance arguments, evidence presentation and overall case strategy. This will help you identify the areas of improvement. So, involves assessing the case and strengths and weaknesses. Implement the changes to prevent the similar cases. Involves the addressing the identify the weaknesses, revising the procedures and adopting best practices to mitigate the future risks and the issues. So, post case review will help you to progress further and which will give you the idea of what are your strengths and weaknesses we are supposed to go ahead and which are the weaknesses where you should be overcome. This is a post case review, the conduct a thorough review of the case, identify the areas for the improvement and implement the changes to prevent the similar cases, and you will understand your strengths and weaknesses also. Steps in handling the medico legal case. By following these steps, healthcare providers and organization can effectively manage medico legal cases, minimize the risk and ensure the quality patient care in handling the medico legal case. Next is reporting and documentation protocol for medico legal case management. In this reporting the documentation protocol and medico legal case management, incident reporting, immediate reporting of the incident to supervisor or the risk manager. Complete incident report form within the 24 hours. This should include date, time, location, parties involved and details of the incident. So, immediate reporting should be done. So, incident reporting is required, which is a major protocol in documentation of the medico legal case management. Medico legal report is maintain the accurate and detailed medical records, document all the patient's interactions, treatment and communications, include witness statement and contact information and use standardized documentation templates for the same. So, reporting and documentation involves this also, accurate medical records. Maintaining the accurate and detailed medical records, document all the patient interactions, treatment and communication. This includes statements and contact information. Use standardized documentation template which can be utilized as a medical record. Medico-legal report, prepare a comprehensive report within 30 days, which include incident summary, patient's history, treatment provided and expert opinions. So, this also involves expert opinions. Attach relevant medical records, witnesses, statements and evidences is a major part of the medical case management, and it should be done or prepared within the 30 days. Then you have to take a peer review. Conduct a peer review within 60 days. Evaluate standard of care, identify the areas of improvement where you can observe the strengths and the weaknesses which you can further avoid, and document findings and recommendations, where what is documented findings are requirement and where it should be recommended, that should be conducted by the in the peer review by within the 60 days. So, you can understand the areas of improvements also by evaluating the standard care and identify the cases. Then root cause analysis. Conduct a root cause analysis within 90 days. For this, again the important process, identify the system failures and what are the root causes, why the system fails and where it fails and what are the that points where it something went wrong. So, you have to find out the root causes for the same and implement corrective actions to prevent the similar incidences. So, that by observing the strength, by reviewing, by understanding the root cause analysis, you can implement the corrective actions to prevent the similar incidences. Legal documentation. Maintain a separate legal file for each case, so that you can understand the perspective, time, date, all these things documented in record can be kept properly in the each separate file. Include all correspondence, reports and evidences again separately related with that file. Ensure confidentiality and security of legal documents. So, you have to keep all these documents securely, and confidentiality of the patient should be maintained in the medico legal case management. So, you should not reveal anything without discussing or without asking by the authorities. Electronic documentation. Reporting and documentation protocol involves the electronic documentation also. Use secure electronic documentation system, and whatever the secure documentation system you are involving, you should not reveal the details of that documentation and security purposes codes. Ensure the password protection and access controls. So, your password, whatever password you are keeping, it should be protected and it should have only the access person should have the control over it. Then electronic documentation, the main is the regularly backup your electronic data. So, data will not be misplaced, that is also an important factor or key factor of documentation protocol. Retention. Retain a medical records for minimum of 10 years. Retain the medico legal reports and documentation for 20 years and ensure compliance with relevant laws and regulations. So, whatever documentation or whatever medico legal cases you are keeping, the record should be maintained for the 10 years and retain these medical reports documentation for 20 years. Interaction with legal authorities in medico legal case management. Medico legal case management, first key is the communication, clear and concise communication. Effective communication with legal authorities in medico legal case management involves clear, concise and accurate information, exchange for informed decision making. So, clear and concise communication is required. Effective communication with legal authorities is required. Use of plain language, avoid medical jargon, that is, use plain language when interacting with the legal authorities, avoiding medical chaos or medical jargon to ensure clear and accurate understandable communication, because this subject is medico legal subject, but legal persons or the court procedure does not understand the medical terms. So, instead of using heavy words or heavy medical languages or heavy terminologies or diagnostic languages, you can use the plain language and avoid medical issues or medical terminologies. Be respectful and professional. Be respectful and professional when interacting with legal authorities, maintaining a courteous demeanor and presenting information clearly and accurately. So, while giving the data also, you have to explaining or interacting with the legal authorities, we have to you have to respect the profession, you have to give the respectably, maintain the demeanor of the court and presenting the information clearly and accurately. That is called as the communication or interaction with the legal authorities in the medico-legal case management. Here we have seen the three things, that is clear and concise communication, use of plain language, not to use heavy medical terminologies which the legal authorities will not able to take it, and be respectful and humble while doing this professional management. Documentation. Provide accurate and complete medical records. This is a key or very important aspect is this maintaining the documentation has three things, that is provide the accurate and complete medical records, then ensure documentation is legible and organized, and use standardized documentation templates. Documentations provide the accurate and complete medical records involves legal authorities ensuring all relevant details are included for thorough case evaluation. To have a thorough case evaluation, you should provide the accurate documentation for the same. Then ensure documentation is legible and organized. So, ensure all the documentations is legible and organized, well written and making easy for the legal authorities to review and understand the medical information. So, you should use not to use heavy terminologies of the medical diagnosis, but it should be readable, it should be legible and it should be understandable for the legal authorities to come to a conclusion. Then use standardized documentation templates. So, there has to be a standardized documentation, nothing should be in the secret formulas like secret documentation or secret templates or some new inventions. You should use the templates to ensure consistency, accuracy and ease of understanding the medical records for legal authorities. So, use the templates which are standardized and which includes the documentation templates properly. Testimony. Prepare thoroughly for the court appearances. So, by reviewing case details, organizing evidence and practicing clear and concise testimony. Second is be familiar with medical records and evidences. And third is provide objective and unbiased testimony. Here these aspects, three aspects are while interacting with the legal authorities. First is prepare thoroughly for the court appearances. So, by reviving the case details, organizing the evidences and practicing clear and concise testimony is the first requirement. Second is be familiar with the medical records and evidences. Be thoroughly familiar with the medical records and evidences to provide accurate, confident testimony and effectively support your case in the court. And be familiar with the medical records and evidences. Provide objective and unbiased testimony. Provide objective and unbiased testimony by focusing on facts and medical evidence without any personal opinions or emotional influences. So, the person who is presenting in the courtroom and the court of law should not have any biased or personal opinion or emotional influences. Whatever, so he should have a unbiased testimony, whatever the facts, what are the evidences, what are the documents and what are the testimony are suggesting and what are the recordings, medical records are telling, based on that the person should come to some conclusion and it should not be influenced by the emotionally. So, provide objective that is called as unbiased testimony which should be presented in the court of law. Expert opinion. Provide expert opinion within the area of the expertise. This expert opinion has the three protocols, that is provide expert opinion within the area of expertise. Second is base opinion on the thorough review of medical records and evidence. So, provide expert opinion within the area of expertise means offer the expert opinion strictly within your area of expertise. The person should be skilled and qualified and has gained the sufficient experience who will guide you and give the expert opinion, skilled opinion, ensuring your insights are relevant, accurate and based on the established knowledge. Whatever knowledge you are sharing, whatever the insights you are putting, it should be accurate and it should be the covering the expert opinion of that area, that field of area, that is called the skill or expertise opinion, which will give you the idea of the established and accurate and relevant knowledge to provide expert opinion within the area of the expertise. Base opinion on thorough review of medical records and the evidence. Base your opinion on a thorough review of medical records and evidence, ensuring your conclusions are well supported and accurate. Be prepared for the defendant opinion. Effective interaction with legal authorities ensures accurate medical case management and promotes justice and compliance. So, because of the effective interaction, because you are of preparation with the and having the proper rapport with the authorities, ensures the accurate medical case management and promotes the justice and compliance. So, expert opinion has got these two things. Then subpoena. Subpoena is the respond promptly to the subpoena, clarify scope and content of requested information and ensure confidentiality and security of the records. Subpoena ensures that whenever the legal compliance maintains case integrity and demonstrates professional responsibility. Subpoena is also called as the summons, where the person has to attend the court of law when the order is given by the court, which is the document compelling the attendance of the witness in the court of law and act as a witness in the courtroom. This summons is also called as a subpoena. How to respond this? To respond promptly whenever the court asks you to come in the court and act as a witness in the court of law, you have to respond and respect that subpoena promptly and ensure that whatever you are giving in the subpoena has some legal compliance, it maintains the case integrity and demonstrates the professional responsibility. Second is clarify the scope and content of requested information. So, you have to be very clear about the what is the scope of whatever information you are giving in the court of law and what content you are sharing should be requested information, ensures it should be accurate. Whatever information you are putting, it should be related with the case, it should be accurate, you have to be very sure about that. Then it should be relevant responses and not to create, but you should help for the proceedings. So, to avoid the misunderstandings. So, the content and the scope and the accuracy, whatever the information is requested, court requested to you to put in the court of law and act as a witness, should be clearly contained and it should be accurate, so that it will avoid the misunderstandings. Ensure confidentiality and security of the records. So, whatever the records you are providing, it should be very sensitive information and you have to be very responsible while doing this. So, you have to maintain the confidentiality, you have to maintain the secrecy, you have to understand the sensitivity of the information, so that you can maintain the trust and the legal compliance. So, this plays an important role, as in the sensitive cases your record should be secure and it should be sensitive and it should be kept confidential. That is the call of subpoena. Next is court appearances. Court appearances has following points, that is dress professionally and be punctual, be respectful to the judges, lawyers and court staff, provide clear and concise testimony. Whenever you have been subpoena has been posed or summons has been served, so what should be your court appearances? So, dress professionally and being punctual, demonstrate the respect, competence and reliability in legal and medical contents. That is the intensity of this simple sentence of dress professionally and be punctual. So, you have to punctual at the time when the summons is served, where their mention is what relation and in what response you have been called in the court of law. So, to demonstrate that you have to be very punctual and you have to dress properly and respect the demeanor of the court in the medical consents. Be respectful to the judges, lawyers and court staff. Being respectful to the judges, lawyers and court staff fosters a positive atmosphere and supports the effective legal proceedings. By doing this, you are fostering the positive atmosphere and which will supporting the legal proceedings which will move ahead. Provide clear and concise testimony. Providing clear and concise testimony ensures accurate communication and enhances the credibility and effectiveness of your evidence. By giving clear and concise testimony, which will give the accurate communication and which will help and support the legal proceedings and which will enhance the credibility and effectiveness of your evidence. So, by appearing in the court of law, by producing the evidence, that should be the effective gesture and that will give the reliability of the legal and medical consents and which will give the very healthy atmosphere in the court of law for the effective legal proceedings. Legal counsel. Collaborate with the legal counsel, seek guidance on the legal matters, ensure understanding of legal obligations. Collaborate with legal counsel means ensures informed and cohesive case management and enhances the quality of legal strategies and decisions. Seek guidance on legal matters. Seeking guidance on the legal matters helps informed decisions, compliance with the laws and effective handling the complex issues. Ensure understanding of legal obligations. Ensuring understanding the legal obligations prevents the compliances issues and supports accurate and ethical conduct in the legal proceeding. So, by maintaining the legal counsel in the medico legal case management, while interacting the legal authorities, you have to have very collaborative legal counsel. Then you have to have seek the guidance in the legal matters and which will ensure you the understanding the legal obligations. Confidentiality. Maintain confidentiality of the patient's information. Maintaining confidentiality of the patient's information, it will upholds privacy of the patient, that is the patient's secrecy, that is called as a professional secret, fosters the trust of the patient. By fostering the trust of the patient or the person in the cases of medico legal case and ensures the legal and ethical compliance. Then next is ensure secure storage and transmission of the records. Ensuring the secure storage and transmission of the records protects sensitive information from unauthorized access and breaches. So, by keeping and storing it properly, you can unauthorized access can be denied easily and confidential maintenance of the confidentiality will be more easy. Limit the access to the authorized personnel. Whatever the confidentiality you are maintaining it for the authorized personnel only. So, limiting that access prevents the unauthorized use and maintains the integrity and confidentiality of sensitive information, that is called as the confidentiality. Compliance. Familiarize yourself with relevant laws and regulations. Ensure compliance with legal requirements. Seek legal advice when uncertain. How to maintain the compliance or have an interaction with the legal authorities in the medico legal case management? So, you have to be familiarize yourself with relevant laws, and how you will be familiarized with the relevant laws? By updating and training yourself with the current updates of the laws, regulations and ensure compliance and informed decision making professionals in the practice. Which are the cases what is going on outside in the other fields or in the such relations, or if you are observing and handling such kind of cases, you are reading, you are learning, you are training yourselves, you will be become familiarized and you can give the more relevant, you will understand more relevant laws and regulations in this respect. Then ensure the compliance with the legal requirements. Ensuring the compliance with the legal requirements which will avoid the legal repercussions and upholds ethical standards and professional integrity. So, these are the ensure the by keeping the compliance you can avoid the several repercussions and you can maintain the professional integrity. Seek legal advice when uncertain. When you are uncertain about the legal aspects, you have to avoid the uncertain events, you have to ensure yourself, you have to take the accurate guidance, prevent the mistakes and protect against the legal risk. By taking this legal advice, you can avoid these uncertain events and mistakes. Interaction with legal authorities in medico legal case management. To sum up this point is, by following these guidelines, healthcare providers can effectively interact with the legal authorities. They can have to ensure the smooth and successful medico legal case management process. This approach not only upholds the integrity of the legal process, but also enhances the quality of patient's care by ensuring that all medical records and testimonies are handled with the utmost accuracy and confidentiality. Additionally, interacting with the legal, what is in the medico legal cases, additionally it fosters collaborative environment where legal and medical professionals work together seamlessly, ultimately leading to more informed decisions and better outcomes for all the parties which are involved, and you can avoid the bias in such kind of cases by interacting with these things. By adhering all these principles, healthcare providers contribute to a system that respects legal standards and prioritize patients' welfare. So, interactions with the healthcare providers can be effectively effectively in medico legal management of the case. Case studies and practical insights in medico legal case management. So, we will go through certain case studies for the practical insight. Case number 1 is delayed diagnosis. A patient presents with the symptoms of appendicitis, but the diagnosis is delayed, leading to the complications. Practically, how to overcome with this? That ensure timely and accurate diagnosis, document all the steps taken to reach to a diagnosis. If the claim is of delayed diagnosis, you should have to have a opinion, and for timely the entry of the patient, time of the patient, sign and symptoms and complaint of the patient at that time, your referral notes, your documentary record, whom you have referred, what was the expert opinion you have taken, what are the investigations you have done, all these records must be kept. So, the practical insight in this is delayed diagnosis of the appendicitis case that can be avoided, or all the documents has to take the reach the diagnosis. So, you have to take the that insights of the same. Medication error. A patient is administered the wrong medication resulting in adverse reaction. This was the case. So, practical insight is implement double checking procedures for medications. What precaution you can take is, after the prescription you have to see to it that you have to double check the process of the medication administration, and you can ensure accurate documentation for the same, that double checking was done to avoid the wrong medications resulting in the adverse reaction of the patients. Case 3 is taking the informed consent. A patient undergoes a procedure without proper informed consent is absolutely a wrong thing to do. Whenever patient came to you, approach to you, you have to take the proper informed consent. Practical insight or practical approach or resolution for this is, ensure that patients understand the risk and the benefits of the procedure and document informed consent. So, both the parties, patients and the doctor, both knows that there is a risk in handling the patient and doing the procedures, but still you are taking that risk with the consent of the person. So, documentary informed consent is very important when the patient is going under the any of the emergency procedures. Case 4 is medical record tampering. A healthcare provider alter a patient's medical record leading to a legal consequences. So, you should not do any tampering related to the medical record. It is unethical, it is illegal. Practical insight is maintain accurate and tamper proof medical records and ensure that all entries are dated and signed. So, that document has some value. The document is called as tamper proof when it is signed by the authority with the date and signature. That is the authentication of keeping the medical record, and it can be tamper proof, and that has to be maintained. So, nobody, no healthcare provider or none of the person can alter the medical record and face the legal consequences. Fifth is expert witness testimony. A healthcare provider is called as an expert witness in the medico legal case. Practical insight is prepare thoroughly for testimony, ensure that opinions are based on through review of medical records and evidences. It should not be biased and it should not have any emotional influences. Whatever testimony you are providing in the court of law, it should be of the medical record and it should be based on the evidences which are provided to you. These case studies and practical insights highlight the importance of accurate and timely diagnosis, medication safety, informed consent, accurate and tamper proof medical records, and thorough preparation for expert witness testimony. So, that is the importance or highlights of keeping the practical insights in the medico legal case management. Case studies and practical insights management. By learning from this case studies and practical insights, healthcare providers can improve their medico legal case management skills and reduce the risk of legal liabilities. This proactive approach enables providers to identify potential issues early, implement best practices for documentation and communication, and refine their strategies for interacting with legal authorities. As a result, they can navigate complex legal scenarios more efficiently, ensure compliance with relevant regulations, and ultimately enhance patient safety and care and quality. Continuous education and application of these lessons also contribute to fostering a culture of accountability, professionalism within the healthcare settings. Thank you.